I'm Meredith Laura, and I'm working with the Internal Medicine Clerkship leadership team to launch a faculty development series that aims to help you improve your teaching on the wards. Before we start, though, let's review an important piece of the why are we doing this. The Internal Medicine Clerkship, along with other clinical rotations at the School of Medicine, are moving to pass-fail. Like many programs across the country, we are shifting from an accolade-driven view of excellence to one that is much more oriented towards growth, learning, and responsiveness to feedback. In order to achieve the above, though, teachers will need to use an intentional approach to support growth and learning for their students on the clerkship. And this means for many of you that you will be implementing practices that may be a paradigm shift for you. Specifically, we want you to think of yourself as a teacher that develops talent rather than sorting it. This means that we are asking you to envision your role as a coach. A coach works closely with learners on a specific skill, having them practice the same task repeatedly under varying conditions, making small tweaks along the way until they are doing it just right. In order to achieve this, though, you need to establish and promote a growth mindset in the learning climate for all members of the team, and this includes you. In addition, we ask that you commit to direct observation and to use each new data point for learning rather than a score mark of learning. This doesn't mean that assessment doesn't matter or doesn't exist. In fact, it creates even more urgency to identify students that are not meeting core clerkship competencies by the end of the rotation. And we will give you guidance for what to do in these circumstances near the end of the series. This series creates a practical approach to achieving this new model of your teacher excellence by helping you learn how to set clear expectations with your students on day one, giving actionable feedback to develop their skills, and writing descriptive skill-based narrative evaluations. Let's start by talking about setting expectations. Setting expectations on day one is a key practice that you need to implement in order to establish a growth mindset in your team and to set clear skill goals for the student to work towards. But it's also a really practical space to go over the nuts and bolts with the student so that they know exactly what to expect for the week or 2 weeks that you're together. One of the many reasons that students love Dr. Manning as a wonderful attending is because she sets clear expectations on day one. So let's make sure you know exactly what we expect of students and what their skill goals should look like so that we're all on the same page. First of all, what role should students be playing on the team? We expect students to be fully immersed in patient care and to perform all of the activities that an intern does. They should be the primary provider and be the person that the patient looks to for their care. They should take histories and exams independently, pick up patients regularly, and carry 2 to 4 patients at a time. How often should you expect to see students, and what other activities do they have? You can expect to see your student about 6 out of every 7 days on the wards. They're required by the School of Medicine to take 1 day off every 7 and to take 2 wellness afternoon half days over the course of the 8-week clerkship. Pause here if you want to take a look at the clerkship schedule more in depth. So we've reviewed the nuts and bolts, the what, the when, and the where. The fourth component of expectation setting is around skill growth. Specifically, we want you to discuss goals for the students' skills during your time together and to promote the overall expectation of growth and learning rather than performance. This is where you have an opportunity to frame your role as a coach that'll help the student develop a stronger skill set during your time. But it's hard to set expectations for skill goals unless you know exactly what doctoring skills should look like at this stage. All right, so this is the RHYME framework. It's a really concrete, intuitive mental framework that helps you understand the growth from the preclinical years to being a doctor. It's called RHYME because of the 4 stages, which are reporter, interpreter, manager, and educator. Generally, the goal of the clerkship is to become an interpreter, and that's really where students are able to interpret and make conclusions of the data that they've gathered, but that's not where students start. Students spend a significant part of the clerkship working to refine reporter skills. And a reporter level is what they must be proficient in to pass the IM clerkship. This is where they learn their data gathering and data reporting skills. Being able to gather a history and exam at the bedside that's organized and complete, collected appropriately, and focused to the biggest problem at hand instead of including a lot of extraneous data, and then delivering that information along with the data in the chart in an organized, easy to follow, and focused oral presentation. An interpreter is able to put things together pretty independently to synthesize an assessment statement that captures the clinical syndrome, to be able to form their own differential diagnosis and to defend it, to identify and prioritize the problems and name them appropriately. And when gathering the history and physical or when giving their oral presentation, you can hear them pursuing hypotheses through their questions and maneuvers. Interpreting is the goal skill set for the clerkship. A few students make it to the manager level, which in the old tier system would have been your A+ student. And ultimately we tell students, hey, this is not really your goal, but it's great if you make it here. These are the students that not only can form an assessment, a differential, and a problem list, but it can actually form a diagnostic and treatment plan pretty independently for more than just the most bread and butter cases like heart failure. So that's how we think about student skill expectations using the RHYME framework to map out growth. So you might be thinking, how do you use that information to talk about skills with students and to set them on a clear growth path? Well, I think first of all, just like you were really explicit and concrete about the what and the where and the when of your expectations, just be really concrete about the fact that you'd like to set skill expectations. Tell the student, I want to talk about exactly what skills you want to focus on during our time together. And because students that you're working with may start at different points in the RHYME framework, ask the student where they think they are and use that as a starting point. Students are often very aware of where they are on the RHYME framework, but need your help in getting to the next level. But sometimes they're a little off in what they're proficient in and what they need to work on. So it's important to loop back with some feedback about those skills and sort of refining those goals for the rest of your time together. All right, so now you have the what, the when, and the where, and the how of what we expect of students on the clerkship. We really hope that this gives you an idea of how to set clear expectations with your students, to create shared goals for you and your learners, and to create a culture of growth and learning that fosters a really positive learning climate on your team. Please don't hesitate to reach out to the clerkship leadership team for any questions, concerns, or just additional tips or tricks. Here's a link to the paper that helped us develop this approach to teaching your students on the wards. Thanks for watching. Next up, let's use these expectations to set you up to give really quality feedback to your students. See you there.